Great. Thank you for joining us today, and welcome to the CESLC Insider, where you can tune in every other Wednesday at 12 to find education on topics that matter to you. I am your host, Angelique Jackson, and I'm the Manager of Business Development and Marketing here at Charles E. Smith Life Communities. And I just want to remind you that here on campus, we deliver care and experiences that are personally tailored to the people that we serve. We provide a full suite of services, including from independent living options at Greenhouse and Revis House to our assisted living options at Landau House, our memory care residents at Cohen Rosen House, and then for folks that are needing rehab after a long hospital stay, we have our post-acute care at Hebrew Home of Greater Washington, as well as long-term care. If you have any questions or if you'd like to schedule a tour, the information will be in the chat. Also, just a few reminders before we get started. This program will qualify for one category, one continuing education unit for social workers. If you are a social worker and you would like a certificate after watching this program, please email Amanda Painter. You will see her email address in the chat. And give us about 7 to 10 business days to get back to you with those certificates. And we really appreciate your patience. Thank you. And it is also important to mention that the name that you would like to appear on the certificate matches the name that you registered to the event with, as well as the name when you're logging on to view the program.
Excuse me,
Angelique.
Angelique.
Have any additional questions?
Angelique, I'm sorry, I'm going to interrupt. This is Robin. There's a really bad echo in the sound. I'm hearing that from a couple of people, and I'm not sure where that's coming from. Is something set up differently in there?
Nothing is set up. Are you logged into Zoom? You have to. Is this better? I'm so sorry.
I think that's better. Let's try it.
Okay. So should I start over? I'll start over. I just want to remind everyone that this program qualifies for one Category 1 continuing education unit for social workers. And if you are a social worker and would like a certificate after watching this program, please email Amanda Painter. You will see her email address in the chat, and give us about 7 to 10 business days for us to email you with your certificate. We really do appreciate your patience. And it is also important to mention that the name that you would like to appear on your certificate must match the name that you use to register, as well as the name that you use to log on to the program. If you have any additional questions, please add them to the chat, and we will be sure to answer them. So thank you. I think all that's out of the way, and we will begin. So thank you so much. We have Mark Gottlieb with Gottlieb Insurance Advisory joining us today to talk about all things Medicare. Mark, thank you so much for joining us. Really appreciate it.
No, thank you. I'm very grateful, and I appreciate the opportunity to be here today. And hopefully I can provide some enlightenment. I know this is a very busy time for Medicare, given that we're in the annual enrollment period. So everyone is receiving 800 calls, flyers, mailers, seeing advertisements every day. So I think it's a great time to take a look at some of the issues associated with Medicare so people understand what they're being bombarded about and making their own decisions.
Thank you. So what led you to this road down to being the expert in all things Medicare?
Well, I've been in the long-term care field for a while. I've been on the healthcare administration side, and then recognizing people's need for long-term care insurance, I actually entered the insurance field from that perspective. But as I got more and more involved with that, a lot of people were saying, well, can you help us with Medicare? So I kind of evolved into Medicare, and of course, the longer you do it, the more detailed it becomes, the more research you do, so you try to become an expert and answer everyone's questions appropriately.
With all your wisdom, you must have seen Medicare evolve over the years.
I've seen it evolve, and certainly when you're talking about the Medicare Advantage side of things, it's definitely evolving very rapidly. And that's a lot of where the bombardment, if you will, with all these different products is coming from. So it'll be helpful as we get into that part of the presentation to talk about how all these different products relate to the federal government program of Medicare.
Great, which brings me to my first question. Can you give us a little bit of an overview of Medicare and what some of the basics are?
Okay, well, Medicare, of course, is primarily for the population 65 years and older. It is also available to people on Social Security disability income if you're under the age of 65. In the 25th month of SSDI, you can sign up for Medicare. It also applies to those who are who have end-stage renal disease, ESRD, as well as ALS, also known as Lou Gehrig's disease. So it insures 63 million people in the population, which is quite significant. About 51 million of them are the age of 65 plus. So you can see why it's such a large and important program.
Right, so you did answer one of my questions about if there's any other exceptions to the rule, but thank you for the explanation.
Appreciate that. And of course, I think the other part is, can you give us some basics? So really you start with Medicare offering Parts A and Parts B. And then of course there's D, and during annual enrollment, a lot of people are hearing about something called C.
Mm-hmm.
C is otherwise known as Medicare Advantage, but a lot of the information you receive just keeps talking about Part C, and really what that is Medicare Advantage. So we'll be getting into that. But Part A is free if you've worked, you or your spouse has worked for 40 months, 10 years if you've contributed to the Social Security system and the Medicare Trust Fund. And if you haven't done that, there is a way to buy into Part A as well. Part B and A is for hospitalization and for actually hospice, terminal illness coverage. Then Part B, of course, is for the outpatient side. So anything not in a hospital is really, or a skilled nursing facility is really considered Part B. So those are the basics. And again, as we evolve into this program, we'll also talk about Part D, as in prescription drug plans, because they're very relevant during this time of the annual enrollment period.
So I have a question. We talked about, to backpedal a little bit, and thank you so much for that overview. So what if I am 65 and I still want to work, and I'm getting insurance coverage through, my employer? Do I have to automatically, when I turn 65, sign up for Medicare?
Not at all. It's suggested that you sign up for Part A at age 65, and that is free. You do not have to sign up for Part B if you have good employer coverage. You can keep that until you work, and until you stop working. And more people work now, myself included, past the age of 65. And they can keep their employer coverage, but they also have the option of going to Medicare. So if the employer coverage isn't as good, if the premiums are very high, you might get a better deal going to Medicare. So it is an option, but the vast majority of people will work. At the time they're going to retire, they will then sign up for Part B, assuming they already have signed up for Part A at age 65. And then they sign up for Part B, and then from there we'll talk about some of the supplementary types of programs that you can also get into to supplement Part D because it doesn't cover everything.
So we talked about Medicare and insurance. What's the difference between, private insurance and Medicare?
Actually, there's a lot of similarities. I mean, basically, whether it's Medicare for age 65 plus, or those in some of the other government programs I discussed, or you're under 65, you're talking about having coverage pretty much that will cover inpatient and outpatient care. It is what we'll call acute, immediate need medical care, and short-term, up to short-term rehab. So whether you're buying an employer plan, whether you're individually covered and have a plan from one of the insurance companies, or you're on Medicare, you're basically talking about having inpatient and outpatient coverage.
So then we're here to talk about Medicare A, B, C, D, and in my experience working, I only really knew about Medicare A and B. So I guess beyond that, we need insurance beyond Medicare. Are there?
Right. Well, when you say beyond Medicare, again, Medicare, the basic is the government program of A and B. So the question becomes, why do I need more than that? There are several answers. Number one, Part B only covers 80% of your outpatient costs, okay? So the 20% is the major reason when you're seeing all these advertisements they're talking about, do you understand that Medicare B only pays for 80%? Don't you want to have coverage for the other 20%? So that's one reason. Then, of course, you get into, well, do I need a Part D plan, prescription drug? When you have an employer plan, they typically, of course, will also cover prescription drugs. When you have Medicare A and B, it does not cover prescription drugs, other than, let's say, infusion therapy, something like that, chemotherapy, that Part B will cover. But otherwise, drugs fall under category Part D, prescription drugs. Everyone should get a prescription drug plan. And I can explain that when we get to the segment specifically addressing what Part D prescription drug is all about.
All right, so let's do it. So Medicare A, you mentioned a little bit what that covers. You said hospital, for your hospital stay, what about?
Hospital, and then I'll pick up on that and say the first 20 days in a skilled nursing or rehab facility is covered with Part A, with the proviso that you have a 3-day inpatient stay. And this is a very important thing for people to be aware of. If you don't stay in a hospital for 3 days and then you go to a rehab center or a nursing home for short-term care, they will, Medicare, not they, but Medicare specifically will not cover you. So you have to be aware of that 3-day inpatient rule. It almost seems outdated given that hospitals are trying to get us out very quickly, but that rule is still in effect. So if you get transferred over to a skilled nursing or rehab, for instance, you had a mild stroke, you had a hip replacement, they want to send you to a rehab facility to rehabilitate, the first 20 days will be totally covered by Medicare Part A.
So then, oh, I'm sorry.
That's okay. I was going to say, after that, there are co-pays for days 21 through 100, unless you have the right supplementary coverage.
So I hear co-pay, so I hear that's out-of-pocket expense.
Co-pay means out-of-pocket expense, yes, and everyone's trying to limit their out-of-pocket responsibilities. And of course, when we talk about Medicare Advantage plans, that's a very important component that people need to understand. It's not well emphasized when you're looking at all of the different advertisements. Once again, they're always trying to just talk about the positive aspects of the particular policy. Now, I'm not against Medicare, not by any means.
Right.
It's an important component. I happen to offer all of them. I'm an educator. I like to think of myself as that, and also a salesperson. So I offer all of these products. So I understand all of the details in each of these products. I also understand when I'm seeing flyers and I'm seeing ads that they don't always emphasize some of the less popular components of that coverage. So one must be aware before taking a step and signing up for any kind of particular plan.
So is there anything, are there any programs to help with the coinsurance? Let's say you do have a long hospital stay, you've had a stroke, now you are rehabbing at Hebrew Home. Now it's, you know, the physician and the therapy team, the whole interdisciplinary team have decided that you're going to stay beyond 20 days. And now you have the co-care. Are there any programs to assist beneficiaries with this?
Yes, typically Medicare Supplement Insurance, at least most of the plans, will cover days 21 through 100. And that's a big distinction. With a lot of the Medicare Advantage plans, there are co-pays involved until you hit an out-of-pocket maximum. So that's the good side of the coin. The out-of-pocket maximums mean once you've spent that much, you're 100% covered. But for Medicare Supplement, there's no necessary out-of-pocket maximums. If you bought a Medicare Supplement policy, they should cover days 21 through 100 fully in rehab or skilled nursing for a portion of time. Again, after day 100, a person is basically on their own. That's really considered long-term care territory. So that's why the emphasis these days is the population's aging, talking about is long-term care something that a person should be thinking of as another way of protecting themselves, because Medicare will only cover you up to day 100 pretty much.
So you mentioned some of these supplemental insurance. Are there a lot to choose from, and can it be costly, the premium?
Medicare Supplement is offered by private insurance companies. It is supplementing your Part B. So when you sign up for Medicare, you have your A and your B. You are paying a premium for Part B, but it doesn't cover everything. So that's when people are looking at Medicare Supplement. There are a number of companies, that private insurance companies selling these policies, probably about at least 20 of them in the state of Maryland. They're sold by state, although they're portable. So if you buy a Medicare Supplement policy, you can take it with you. You can use care anywhere in the country. You can take it with you anywhere in the country. There are about 20 different plans. There are different plan letters, if we're getting into the guts of Medicare Supplement. There are letters A through N, as in Nancy. They have
more letters.
More letters. Forget the A, B, C, and D. And that, of course, is why people are confused about Medicare.
Yeah.
Because you have government A and B, you have Part C, which is Medicare Advantage, which is sold by private companies. You have Part D, prescription drug plans, sold by private insurance companies, although regulated through Medicare. So plans A through N, a person has to understand all the different components of coverage of these Medicare Supplement plans. The fullest supplement plans are, the fullest one now is Plan G, for those who are over the age of 65 and may have bought Medicare Supplement coverage prior, that most people were familiar with Plan F.
Okay.
So F is no longer offered for new people who are signing up for Medicare. It now has become G. The only difference is you have a Part B deductible you must pay if you have a Plan G. The Part B deductible is $203 this year. Next year, it will go to $217. So the deductible tends to increase a little bit each year. That means you have to pay that out of pocket before your coverage kicks in. So that's something to know. There's also, for instance, a more popular option these days because it's less expensive. There's something called a Plan N, which gives you pretty full coverage, but you have to pay a $20 copay for each physician visit.
Oh, good.
So if you can save some money by purchasing a plan, but once you start using a lot of outpatient care, all of those co-pays could make it so that maybe you were better off with the fullest coverage to begin with.
So that brings me to a great question, because obviously our health needs change, so then our coverage will obviously change. So if we are getting a Medicare supplement plan, is it hold to the same rules for open enrollment?
That is a great question, very, very important topic to address. Medicare supplement is not part of the annual enrollment like Medicare Advantage or prescription drugs.
Okay.
And of course, by the way, so every year you have annual enrollment period, October 15th through December 7th, you can make changes to your Medicare Advantage plans or your Part D prescription drugs. It's very important to look around, assess what you have. This is an opportunity to change them. Sometimes our drug regimen has switched. We ought to be doing a new analysis to see if the plan we have is still the most cost-effective plan. For Medicare supplement, you do not have that option. So once you're through the initial period of Medicare supplement, if your health should change and you say, I'd like to switch my supplement plan, you probably will not be able to do that. There is something called the guarantee issue period for Medicare supplement, which means under certain circumstances, they'll allow you to buy a supplement. It often involves changing geographic locations and changing out of one type of plan to another. For instance, you live in Arlington, Virginia, you're moving to Rockville, Maryland, you're in a Medicare Advantage plan there, your health is bad, but you're moving to Rockville, you think you'd rather get a Medicare supplement, and you can do that. Mm-hmm. So that is called, there are certain conditions under which guarantee issue applies. Sometimes it does not. People, of course, would love the opportunity to get a guarantee issue. Doesn't always work out that way. So if you just on your own say, my Medicare supplement's becoming more expensive, I want to change my plan, either by company or by letter. We talked about the letters. We did. Then the issue is going to become, how is your health? Has anything changed? Because you are going to be what's called medically underwritten. You will be evaluated just like you are when you buy life insurance or long-term care insurance to see if that insurance company wants to take you. They consider us risks. You know, rather than policyholders, you know, so they want to make sure they're not getting out a little bit of premium so that they're going to have to pay out all this money for us.
Calculating the risk, right.
But in any case, so great question, and, you know, Medicare supplement comes under a different set of rules than Advantage plans and prescription drug plans.
I can't imagine having to know all of this. Thank you.
Thank you for giving me the opportunity to share this information.
Now, moving on to Part B, can you go over a little bit about, again, what Part B covers? I know we talked about premium costs, what those look like. Can you go over that for us as well?
All right. Well, Part B, again, is the government program. You're not buying a private insurance plan. Part B will pay 80% of your outpatient costs. So if you don't have many medical expenses, some people may say, well, why do I need Part B? I go to a physician visit, it's $100 if it is. And, you know, so Part B is paying 80%, $80. That leaves $20. No problem with that. Why should I invest in a Medicare supplement plan of $100 to $150 a month for an occasional $20 bill? And the answer is, at that point, you're right. You saved some money by not being insured. But the big issue with insurance is you don't need it until you need it.
Right. That's how they get it.
Once those 20% start adding up for, you know, expensive diagnostic imaging tests, for emergency rooms, for observation stays in a hospital, which are not covered under Part A, something a lot of people are not aware of. So they keep you overnight, they do some tests, and they still don't really know what's the problem with you. We want to keep you in our observation unit. It's valid from a medical standpoint. They'd like to do that. They don't want you to walk out of the hospital at that particular time. But the bills can be significant. Well, observation is Part B, not Part A, hospital inpatient. So 20%, of $5,000 or $10,000 now becomes kind of significant.
Very significant, because there's no end to,
Right.
your observation status at this point.
That's exactly right. So again, when there's no out-of-pocket max,
Right.
it's your pocket. That's one reason why having a Medicare Advantage plan can be, pardon the pun, advantageous, because you will at least hit an out-of-pocket max. So that is valuable in addition to other benefits you may get from such a plan.
And then also maybe the supplemental insurance would come in handy here as well.
Well, absolutely, yes. Supplemental will cover that 20%. And again, cover different levels depending on which of the letters from the Medicare supplement that you select. Now, the premiums, again, depending on your age, we start, for under age 65, typically you can only get a Plan A.
Okay.
So if you're on Social Security disability, if you're on end-stage renal disease coverage, et cetera, and under 65, you can only get a Plan A. That's different than Medicare Part A and B. It's a Plan A and supplement. It will cover your Part B costs. The premiums are actually a little higher, and you can switch to a regular Medicare supplement plan when you turn 65. But now let's say you sign up at age 65, the prices for full coverage are generally in the $130 to $150 a month range. But to a Plan N, you're talking about $95 to $100. Remember, the N is where you have the $20 copays for physician visits. So that's an example of the cost. So people who don't want to get into that level of cost may look at some of the Medicare Advantage plans being offered, and the premiums in some cases can be as low as $30 to $40 a month.
Okay. So we could almost do a whole show or topic just on the supplement.
It's very true,
So now Part B, Medicare Advantage.
So Part C, a lot of you may be getting little postcards saying, hey, you may not know that you are eligible for Part C. Well, yeah, they get lists. If you're on A and B, you are eligible for C, otherwise known as Medicare Advantage. And again, there's no underwriting. That's one of the great things. So now again, if you're turning 65 and you want a Medicare supplement and you sign up for Part B, or whenever you sign up for Part B, if you have employer coverage, let's say you're working, you're 68, you're 70, now you're leaving employment, you sign up for Part B. Again, you have a guarantee issue right, kind of an open enrollment 6 months after you sign up for B, no underwriting. So regardless of your health, they will give you a guarantee issue Medicare supplement plan. So something very important to think about if you're going to delay trying to get a supplement, because you may not be guaranteed after that point. With Medicare Advantage, yes, they'll take any health condition, which again is a beautiful thing. Most of the Medicare Advantage plans are combined with prescription drug coverage, so they're called Medicare Advantage prescription drug plans.
Okay.
So you evaluate all the different types of Medicare Advantage plans, and I guess I can just talk more specifically about the issues with Medicare Advantage. The two biggest things one needs to be aware of, I think, in my estimation, are which network of physicians and providers, will cover you if you join that Medicare Advantage plan. There's something called networks that typically with what's called HMO plans, So number one, you want to know who's in that network. Now, a lot of people will say, I've gone to physician XYZ for many years, so am I going to have to switch? And I say, well, the first thing you want to do is ask your physician's office. There are, of course, provider directories. You can look that up, but the simplest thing is to call your physician's office and say, does he or she participate in this particular Advantage plan? If they do not, then your first level of consideration is, am I willing to leave this particular physician to join this plan?
Oh, okay.
So networks are very important. There's now a new plan. I won't get into product names, but there's a good new, what's called PPO instead of HMO, which gives you a much wider option to go out of network to use physicians and other providers. There may be some significant additional costs though, so you have to weigh that. If you're really trying to keep your costs down, you'd really much rather stay in network with the HMO type of consideration. But so the network thing is very, very important. The other very important thing is the issue of copays. So when you're talking about how Medicare Advantage relates to private health insurance, for those, well, they could be over 65, but typically in our working years, we have health insurance options, and we're given a choice of 2 or 3 plans that we can join with. There may be an HMO point of service, or a PPO. And there could be different premiums for that, but in addition, there's a different list of services and coverage. So, you know, for one, you may pay 10% copay, another you may pay 20% copay. So again, there's the list of copays until you hit an out-of-pocket maximum. So it is with Medicare Advantage plans. With each service you use, there'll be a copay up to an out-of-pocket maximum. So it's very important to understand that when one is considering signing up for a Medicare Advantage plan.
So do they still offer the same benefits as traditional Medicare?
Well, yes. The answer is yes. Medicare Advantage has to offer the same benefits as Medicare A and B. So that's an important thing to be aware of. So that, you know, that is helpful. And of course, there will also be some value-added benefits. And that's one of the main messages that you're seeing when Medicare Advantage plans are advertising this, saying, look at all these services that you're not getting through Medicare. And so if you sign up with our Advantage plan, we'll throw in some additional services. The most typical ones on a baseline are preventative dental care. Dental is not covered by Medicare at all. And vision, hearing, there'll be some screening tests. They'll possibly give you a pair of glasses up to a certain amount of coverage. I'm not going to give you designer glasses, but typically up to a couple of $100. Some of them are now offering discounts on things like hearing aids and fitness facility.
Wow.
You know,
So those are the advantages.
So those are the advantages, you know. So there are some good reasons, but don't necessarily pick a plan because of that. Again, your main thing, you want to know the network, you know, or what the restrictions might be in terms of choice of providers. And then, of course, you have to be aware of the potential for copays. So, for instance, a lot of people, let's use a typical person turning 65, and you signed up for your A and B, and now you say Medicare Supplement versus Medicare Advantage. Supplement's going to cost you more up front, but you know you're pretty well going to be covered. You go into any kind of setting, you give them your Part B card, you give them your Medicare Supplement card, and if it's one of the fuller Medicare Supplement plans, they'll say, fine, no copay, sit down, we'll be right with you and we'll help you out. If you're on a Medicare Advantage plan, there's going to be a list of go for an MRI exam, and I'll bring I won't bring a Part B card because I've given A and B over to the Medicare Advantage company. I'm giving you the Medicare Advantage card, and that the person at the front desk or in the billing office is going to go, here's our schedule of co-pays consistent with that particular plan. Typically, for an MRI, let's put it in the range of $250 to $350 copay for that service. But again, if you've paid a lot lower for premium, you can accept that. It just becomes a matter of how many copays are going to add up. So, and do we ever know? That's the big problem with healthcare. You know, everyone wants an answer. Am I better off doing this or that? If you have a very healthy year, you would have saved money by being in a Medicare Advantage plan. If you have a significantly poor health season and you're getting a lot of services, those copays can add up. You could say, well, I should have just paid a little more upfront for a supplement, and then everything would have been covered. So it's really a balancing act, and unfortunately, we never quite know what awaits us. But we should have something, because you never know, and you want to at least have some coverage. If you can't afford or don't want to spend what the supplements cost, then you can certainly go with a Med Advantage, and it will give you an out-of-pocket maximum. There's actually one other plan, if you don't mind me just saying.
Of course.
While we're talking about that, there's a third option now. Not many people know about it at all, and I try not to confuse people. But it's an interesting, intriguing hybrid option called a Medicare savings account, where there's zero premium. The government actually is putting some money into an account for you. And again, it's a little bit more complex. If anyone would be interested in knowing about that type of option, I can provide it. But again, they're putting some money, and you can use that to pay for A and B services. And you know, you may have very little expense for the whole year if you have no premium and using the government's money, in effect, from a bank account, a savings account, to pay for some of your care.
So that would really help with some of these out-of-pocket costs that we're talking about.
It really would. So, again, it's an intriguing new plan. People up to now have been just riddled with supplement versus advantage. It's difficult to have to now introduce a third option. But on the other hand, it is yet a growing option, you know, in the plethora of Medicare options. So people should be aware of that.
And I think it's nice to know they have options.
Yeah, options are important.
Options are important. Just need to understand them.
Absolutely. But yeah, you don't always, when you're reading all of this stuff and seeing all the advertisements, again, we need to look more at beneath the surface to really see what we're getting. Some of the Medicare Advantage plans I'll add, it may not be in the formal questioning, but they also offer some add-ons. So for instance, you may have several of the Medicare Advantage plans will offer you can buy up, and for an additional premium of somewhere between $17 and $32, you can buy a dental add-on. Well, you'll get anywhere from $1,000 to $1,500 extra coverage for dental. If you don't do an add-on, you're only getting the preventative dental, meaning, you know, a set of x-rays, a fluoride treatment, a cleaning.
Oh, goodness.
So, but that is not emphasized when you see the ads. They just say, we're going to take care of your dental. And a lot of people may think, well, my problems are over. Dental is so expensive, and they're going to cover it all. Unfortunately, not quite that simple, but you can buy these add-ons and give you some additional coverage to take care of perhaps several of the procedures you have. If you do not buy Medicare Advantage and you buy a supplement, you can buy standalone dental insurance. There are a lot of companies that offer straight dental coverage for people who, you know, need dental care. It's a very important subject in the aging population, but do not get any dental through Parts A and B, nor through a Medicare supplement.
Thank you so much for, letting us know about the Medicare savings plan as well as the add-ons, and just, reminding people, yeah, they're going to show the highlights of what these advantage plans are offering, but it's very important to read the fine print, so to speak. Thank you so much.
It is. Now, you've triggered another thought, if you don't mind me jumping in here, because
we want to make sure we have some time, right? To ask questions.
because Angelique talked about a Medicare savings plan, so I want to make the distinction. The private plans are called Medicare savings accounts. The distinction is because for people in the lower income brackets, they do not qualify for Medicaid, but their income's low enough so that they're struggling with different costs. They're actually governmental programs. So for Part B, if you're struggling with paying for your premiums, for the copays, and you fall within the right somewhere about 150% of the federal poverty level, there are guidelines. You're basically talking in the vicinity of $17,000 to $23,000 of income, then you could qualify for a Medicare savings program subsidy. So that's a Medicare savings program as opposed to the Medicare savings account. So I wanted to make that distinction, okay?
It was very confusing.
Sorry, but it's important for those in that boundary to be able to know they can apply for the Medicare savings program and get some real help with these Part D costs. And also, as a corollary to that, there's something, and we haven't really gotten to Part D yet, but I guess we're getting there next. There is something called a low-income subsidy program, also known as the Extra Help program, that will help people pay for their drugs because drugs are so expensive, even when you have a prescription drug plan. For lower income people, even those copays are too expensive. There's something called the Medicare Low Income Subsidy Program so that you can get help with your prescription drugs. So very valuable to know about those two.
Thank you so much, because those out-of-pocket expenses, those drug costs can get very expensive. So it's nice to know that there are some options to assist with those costs. And then when we get into Part D, I'm so sorry, everyone. This is such a dense, so much information. We'll get to questions. We should just go over Part D real quick, and I really want to get to all of our viewers' questions.
Sorry if I've taken too much time, but we've covered a lot of ground. But really, if you have a Medicare, whether you have a supplement or not, you have A and B, you need the D, prescription drug. I'll emphasize it's important to have prescription drug coverage. So people will say, well, I only take one generic drug, it's $3 a month, I pick it up at Walmart, Costco, wherever. Why should I pay premiums for a prescription drug plan?
Right.
And once again, we never know. So the answer is everything's going along fine. You have an accident, you have a health situation, you get diagnosed with some kind of a chronic condition, you go to the physician, they give you this list of drugs, and you go, oh my God, I don't have drug coverage, and retail costs are mind-boggling. So you need a prescription drug plan. Now, a lot of the discount programs are advertising consistently and saying, well, just join one of these, we'll give you huge discounts. I see some of the ads on TV. Again, for certain things that may work, but for a lot of others, it may not work. So you don't want to just rely on picking up one of these cards at the pharmacy counter and signing up, and there's no premium, and you can get discounts on drugs. They have their own deals with manufacturers. So that's why I say everyone should have a prescription drug plan, because you don't know. Second thing is there are going to be penalties over time. So if you're blessed, you don't have many drugs, you don't join a plan, eventually your premiums will go up 1% per month.
If you don't have Part
If
D,
you do not have Part D, when you're supposed to, if you don't sign up 63 days later from when you lose, let's say, employee drug coverage, and you just never get Part D, or you turn 65, you're not employed, there are going to be penalties. Now, 1% per month isn't staggering on the premium cost, but nonetheless, it will add up. You get a little bit older, and you're going to pay that elevated cost for the rest of your life. So it's just better to buy a low-cost prescription drug plan right up front, and you've got that coverage. And then each year you can change during what is now the annual enrollment period. So people in drug plans, this is a time to reevaluate and see if you can get some better savings by changing. So that's a little bit about prescription drug plans to start.
right,
And then when you're choosing prescription drug coverages, there are a number of issues one needs to consider. One is the drugs you take on what's called a formulary. Each drug plan has what's called a list of approved drugs within their formulary.
mm-hmm.
You want to make sure your drug's in the formulary or it's not going to get paid for.
right,
Okay, so that's important. They tell you you're better off picking a preferred pharmacy chain versus what's called a standard or non-preferred chain. The prices will be better. So check. You may be using CVS. You join a certain program and it says, well, CVS is standard. You want to keep going to CVS, you'll get the standard rate. If you want to change to Walgreens, I'm not, trying to tout any one drug chain, just using it as an example. In our plan, Walgreens is preferred. If you switch to Walgreens, you'll get preferred pricing. So that's two important things to know about prescription drugs. Maybe the most important thing is there are things called tiers, T-I-E-R-S. Tiers. I always say if you don't check your drug prices relative to what tiers they're in, you could be shedding tears. T-E-A-R-S. Little corny, but nonetheless. So there are tiers 1 through 5. There's actually now a tier 6, which is basically for insulin. So for those diabetics on insulin, you can now get great discounts for selective prescription drug plans that offer the insulin savings program, and you'll be grateful that you looked into it and got the tier 6 drug discounts. But, if you're in tiers 1 and 2, very low price, and then as we go up to 3, 4, and 5, the prices become significant, even just for the copays. So, that's one reason to research. One plan may have your particular drug in a tier 3, another plan may have it in a 2. Well, that one tier for that one drug could mean $500 difference in out-of-pocket cost to you.
Thank you. Oh my gosh, so everybody remember to check the tiers before you set tiers on your out-of-pocket drug costs.
Exactly right. Now, there's something called the Prescription Drug Plan Finder on Medicare.gov, which is the primary place to do your research. So you go to Part D, you go to Prescription Plan Drug Finder, anyone who's on here, if you'd like that information, that or on anything we've discussed. Hopefully, you will be given my email address and my phone number. No obligation, no fees. I can help you with your plan finder if you'd like. And what you want to do is enter in your drugs. It will bring up a list of the different drug plans by least cost to most. And this is the last point I'll make. I know I'm taking a long time, but prescription drugs is very important to be aware of.
Oh, it is.
And that's you want to know what the total potential out-of-pocket cost to you for the drug plan is, which includes the premium and all the costs from all the tiers. So don't be fooled and go, I see this plan that's offering coverage for $7.80 a month. It's obviously better than paying $20 a month. I'll join that. Well, after all, we enter into the plan finder all the drugs you take. You may be saving $12 a month on premium, but paying, $40 a month more for the out-of-pocket cost based on that drug regimen. So you want the total cost and what is going to be the least cost for you. So the premium isn't the issue. The issue is the combined cost of premium and drug price by plan. And I will leave prescription drug coverage at that.
Thank you so much, because, that drugs can be, our medications can be costly, but,
Extremely so.
necessary to manage certain chronic illnesses. We will have your information in the chat on how to reach you, your phone number, email address, website. And then let's get to some questions. Thank you, everybody, for your patience. But it's a very heavy topic, a lot of things to cover. It's very important. We wanted to make sure that drugs were mentioned because, again, so many tiers. But some of the questions that we have are from Mensch. If originally enrolled in original Medicare and changed to Part C, so transition to Part C, and then decide to go back to original Medicare, can you do this, and will there be a penalty involved? Great question.
You can go back to original Medicare, but then you're going to have to get prescription drugs, and if you want protection for that 20%, a supplement. So it's a great question because it's a very important consideration, because now you're coming out of Medicare Advantage, you're applying for a supplement because you won't have the advantage to help, with the copay schedule. And now the Medicare supplement plan says, well, we're not underwriting you, so you can't get Medicare supplement. So if you drop the Medicare Advantage, you can get prescription drugs, but Medicare supplement may be underwritten. Now, again, there are times where you can get a guarantee issue Medicare supplement. So if you're leaving Medicare Advantage coverage elsewhere and you're moving here, again, I use the example from Arlington to Rockville,
Right.
or it could be from Los Angeles to Rockville, wherever it happens to be out of the county, because Medicare Advantage plans are offered by county, not just by state, but actually by county.
Oh.
Yeah, amazingly so. You can get, there's certain plans in Montgomery that may not be in Prince George's, that may not be in Anne Arundel. And there may be a lot of similarities as well, but there are some differences. But, so the important thing is, be aware of that issue about changing Medicare supplement. But if you're moving from a different jurisdiction, then you could get guarantee issue Medicare supplement, and then that problem is erased.
Wonderful. Thank you so much. Great question. Then Denise is asking, the state of Missouri provides a Medicare Advantage as my coverage when I retire. Can I switch it if I don't like it?
Well, in fact, again, there are some states and major organizations, employers who have their own plans that they've contracted with. In that case, I'm not sure that your Missouri coverage, if it's a Medicare Advantage plan, would even relate. So this would be one example. If you've changed locations, again, you can perhaps do a guarantee issue Medicare supplement, or you just have to switch to a different Medicare Advantage plan, because the networks, again, for the most part, will be different in each area. If it's a PPO, possibly, but I would have to see the plan. Unfortunately, I'll just piggyback on that and say in general, because we didn't discuss it. People consult with me all the time. I have this retiree health plan. I'm either retired government, federal, state, local, or I work for a big corporation, and now I have a retiree health plan. Am I better off with it or switching to Medicare? And the answer for all of these kind of questions is it depends, because all of these different plans are written differently. If you go to the you know, the different websites for these organizations. You will see the different plans, and some of them are low option, standard option, high option. You know, there's just a tremendous number of plans out there, and you have to look basically at what the outlines of coverage are and what the premiums are. So if someone calls me, gives me, this is my retirement plan, it's covering 100% for everything, costing me $200 a month. Should I switch? Definitely not. That's tremendous. Congratulations. You're very lucky to have it. Someone else will call me, well, I'm paying $700 a month and I still have some co-pays, you know, or some you know, outlays that I have to make. Should I change it? Very possibly, yes. Let's take a look at that. You can get your Medicare Part B plus your Supplemental Advantage, dethrone it for a lot less than that. Yeah, let's talk about making the switch. So it's really very dependent on that.
So it depends.
It depends.
Great question, and thank you. Next question is, so what are the less popular components or downsides of Part B as compared to original Medicare with a supplemental Plan F secondary insurance policy? Whew, that's a complicated question. It has many parts.
Well, no, again, basically, I think that is asking, as I said, okay, so now you've got your A and B, otherwise known as original Medicare. Do I get an Advantage plan, or do I get a Medicare Supplement Plan F, which is the full coverage? So that's great. How much is your Plan F? You also need to have a Part D for prescription drugs. So, you know, what I tried to cover, what are the differences? Medicare Advantage, again, the network issue and the co-pays and out-of-pocket maxes versus the premium expense of Medicare Supplement. And that's pretty much it. And Medicare premiums do go up, Part B goes up, and Medicare Supplement costs go up. There's no, I signed at 65, my bill is $135 a month for a supplement. Well, it'll be next year, maybe $145, next year $155, et cetera. But Part B premiums go up per year as well. The government needs a little bit more money every year. And frankly, it's still a deal given the cost of health care and the aging of the population, to be honest. So.
Thank you. Great question. Our next question we have, you join Kaiser, do you still have to pay the original Medicare premiums every month? Do the Medicare premiums still go up as our salaries go up? Great question.
Okay, glad you asked. And if you join Kaiser, you're talking about Kaiser Medicare Advantage, of course. A lot of people were in Kaiser, they turned 65, Kaiser says, or their Kaiser employer plan, now they're going, no more employer, Kaiser Medicare Advantage. So will the premiums, well, first of all, yes, you need Part B and you have to pay those premiums. Would be a wonderful world if we didn't have to. But these Medicare Advantage plans are billing A and B to get back a lot of the costs of the care that they're providing. Okay, so yes, you cannot avoid your Part B premium. Speaking about those premiums, not only do they go up a little bit, but I'm sure people are aware or should be of something called IRMA, Income-Related Monthly Average Adjustment, so that when you're signing up for Part B, it can be more expensive for households with greater incomes.
Okay.
So be aware of that. There's a baseline Part B. So for people joining now in 2021, although the clock is running, you know, Part B is now $148.50. I believe for 2022 it'll be $158. So that's your Part B premium, and you pay that monthly. Now a lot of people don't think of it. Comes out of Social Security.
Okay.
You know, but so you must pay that portion, and then comes the other expenses of an Advantage or a supplement plan.
Thank you. Thank you. So Denise is asking, can doctors drop Medicare Advantage even after you have chosen Medicare Advantage? That works, right?
Well, can the doctor drop out of the network, you're asking? I assume at some point a doctor may have the right to drop out of the network. I don't know their contractual arrangements. But if they do, of course, there's a, much more extensive list of physicians in that network that you can choose from. So that's the simple answer to that.
Thank you. Yeah, great question. So Tina's asking, in regards to the Medicare Advantage network, other medical coverage needs to be carefully considered. Often rural areas, the eastern shore of Maryland, have a very limited choice of home health and
DME, durable medical equipment
providers,
right?
With certain Medicare Advantage plans.
Well, the Medicare Advantage plan contracts with these different type of providers. So really, if they don't have enough providers within their locale to offer you coverage, then they may reach out and create in some contiguous areas some contracts, right across the county borders, for instance. But that's up to them, and they have to publicize what providers, when you're talking about, do I want to join this particular Medicare Advantage plan, and I go for rehab a lot, who are the rehab providers that are in that network? Again, if they contract with XYZ rehab company, and you haven't heard good things about it, or you find that it's too limited, you may want to look at the other 3 Advantage plans, see the contract they have with the rehab providers. So it's a plan-by-plan contractual relationship.
So it's very important to check those networks, to see
Absolutely.
who's in the network, beyond just the physician.
Exactly right. And hospitals as well.
Yeah.
I'm glad you mentioned that, because they have contractual arrangements with hospitals. So the different Medicare Advantage plans, I know I may be talking to a metropolitan area group here, but let's just use Montgomery County, Maryland as an example. Some may have contracts with a Holy Cross and a Shady Grove. Some may have contracts with a Sibley and a Suburban. And so, if you're used to going to a suburban hospital and you join this Medicare Advantage plan without looking into, do they have a contract with Suburban? They may say no. The hospitals in our network are Holy Cross and Shady Grove. Well, what do you mean? I've always gone to Suburban. You need to know which hospitals are in the network, as well as the therapy providers, rehab facilities, et cetera.
Thank you. Very important. And then what is Medicare Advantage out-of-pocket maximum?
Well, it can be, typically you're looking at out-of-pocket maxes as high as $7,550. So it could get up there. Now that's may only be, in the significant cases of having a condition, a serious condition, or you just had a serious accident. So all the co-pays are going to add up. There's going to be all the imaging, all of the therapies, the days in the hospital, the co-pays, days skilled nursing facility. So you can get up as high. So, in the year you get up that high, you go, oh boy, maybe I shouldn't have been in a Medicare Advantage plan. But you don't know. You could pay low premiums for years in a Medicare Advantage plan and not that many co-pays, and so you actually saved a significant amount of money. And it's the proverbial crapshoot, if I may use the term, because we just don't know. So we make an informed decision and live with it.
Thank you. Thank you so much. And thank you, Mark, for joining us today. And thank you, everybody, for your patience. Again, this is such a very dense topic, a lot of things to cover. If you need to get a hold of Mark to go over this information one-on-one, this information on how to reach him will be in the chat. Again, thank you so much. And then also a reminder that our next CESLC Insider will be December the 8th. We will be doing a holiday cooking demo with Greenhouse Executive Chef Michael Wallace. And so the first 50 registrants, we will have a surprise for you. Again, thank you for tuning in, and we will see you next time. Have a great day.
Thank you for your attention.